if your brain is not functioning properly, the rest is history. Nothing else is going to work.
That's true. The
And
brain is
so,
often forgotten.
Let's have a conversation about cognitive decline. Let's have a conversation about physical decline. We're educating masses about the brain and the spine. We're educating people about balance, gait, and decline. Let's have a neuro wellness conversation. Let's have a neuro wellness conversation. Let's have a neuro wellness conversation.
Welcome to Neuro Wellness Conversations, where clinical insight meets lived experience. We're your hosts, Dr. Katrina Banks and Dr. Lewis, both physical therapists. And today we're starting with a foundational question. What is neuro wellness and why does it matter so much right now?
that's a excellent question, especially for this time of year. We're at the beginning of a new year where so many people are focused on their health and their wellness. Not necessarily neuro wellness. So that's where we come in. We work with people who are doing everything they're supposed to, working hard, staying active, showing up for others, and yet they still feel exhausted. They still feel like they're foggy during the day, they're having fatigue, they're off balance. So neuro wellness is essential for them to fix those things that are broken. And a lot of times those things that are broken are systemic. Um, their brain and nervous system is not doing what it needs to be doing. Wouldn't you say, Doc?
Absolutely right. You explained that really, really well. And I think a lot of people that we see, they don't really understand what's happening on the inside.
Correct.
They have no idea how their brain is functioning, how their body connects with the brain. They have no idea. And that's
Absolutely.
and that's what makes it fun. It makes it more interesting for us as clinicians because
Absolutely.
you just never know who you're
What
going to
to
be
expect.
standing in front of and who you're going to be talking to and trying to problem solve what they have going on.
Right.
And the beauty of it is we get to meet people where they are exactly,
Exactly.
So Dr.
Just-
Lewis, tell us a little bit more about why you became so interested in neuro.
So, it's so funny. My story is there was I felt like I needed a clinical transition. Um, at the time, I was working in a skilled nursing facility, and I felt like my skill set was not being fully used, and I wasn't doing my patients a um, giving them the true justice they deserved. Um, Plus, I felt like I was just getting bored with the profession, honestly.
Mm-hmm.
So me and the good Lord had a good come to Jesus moment.
Love it.
I told him, I was like, listen, literally, I need you to give me direction. I need
Mhm.
direction on where I need to go, what I'm doing. If not, career change is coming.
I love that.
So honestly, I was up late, just kind of Googling on the computer. Should have
Hmm.
been in bed because I know I had to get up there or go to work the next day. But I was like,
Hmm.
I'm looking, I'm searching, I'm gonna find something. And I stumbled on the LSVT big course
Ah.
information. So I started to look at things as it related to neuro, because even though originally I thought I was going to end up doing orthopedic sports medicine type things,
Mm-hmm.
and I ended up doing my master's thesis in stroke rehab, and how the Black community was not as knowledgeable as they should have been in knowing stroke signs, symptoms, and risk factors. And because we were, from my perspective, we were very prevalent and high statistically in being affected by strokes. And so, yeah. And there wasn't a whole lot of research out there as it related to us.
Mm-hmm.
So I was like, okay, let me look at what I can find in that realm, what neuro course that might be out there, what certification. And I stumbled on the LSVT Biggs certification. And honestly, at the time, it was completely booked. Couldn't get in.
Wow.
I was like, you know what? I don't expect to get in, but I'm going to put my name on the waiting list.
Mm-hmm.
Well, lo and behold, 2 days later, I got an email saying that there was someone that dropped off, and there was this opening for me. If I was still interested, I can go ahead and register. So I jumped on.
Amazing.
This is a sign from God.
That's right.
This is a sign from the master. So I went to the course, and it was a game changer for me, because I saw treatment the way that I wanted to treat patients. And so there was like a energy in the room, and it invigorated me and kicked me into a whole new gear.
Love that.
So, yeah. And then after that, next thing I know, because, with LSVT Big, and, because, having done courses, similar, LSVT Big puts you on this registry, or this directory. And I put my name on there, not really expecting to be contacted, but within a week, I was getting, I got 3 patients referred to me in like a span of 2 days.
That's amazing.
Yeah. And at that time I was doing home-based PT. So I was like, my phone was blowing up. I was like, what is good, Lord? All you have to do is trust, right? Trust and believe. And so next thing you know, I'm treating these types of patients, and it just changed me from a clinical perspective. And it changed my interest. So my interest went from more from it went from the orthopedic side to strongly to the neuro side. And then once I got into the neuro side, the rest was history, because I was like, oh man, this is definitely the way we should be treating. Everybody should be treating like a neurotherapist.
Absolutely.
And I think if they did, then the profession would be looked at with a different perspective.
Absolutely.
And what about you, Doc? Give us a little bit about how you got into it.
So I got into, the interest of physical therapy when my aunt had a stroke, and I was in high school, like sophomore.
Oh, wow.
And I didn't understand what was going on. Her speech was off. Her right side was weak.
Oh, wow.
It was just like, okay, this is eye-opening. I've never seen anything like this.
Right.
And it just made me more intrigued about the brain and what was happening.
Yeah.
And being able to go to her physical therapy sessions and see how they got her recovered and able to walk with a cane and go home.
Right.
I was blown away. I was like, wow, this is like a real thing.
Right. Exactly.
And as I, once I graduated high school, went to college, I got into PT school, became a physical therapist, worked in a lot of settings, hospital, home
Right.
health, and any place that you could think of, I pretty much have worked.
We know the deal. We go from one to the other.
We do. But just seeing over and over the neurologic population just not getting what they really needed in the hospital system,
Right.
and then figuring out once, their discharge plan with them leaving and figuring out where they needed to go next
Yeah.
and not finding a place for them to go that would really help them was really eye-opening for me.
Absolutely. Yeah.
And that's how I was like, you know what? I need to open up a spot, a clinic,
Right.
so that I
Yep.
can help this population and allow
Yeah.
them to get the quality care that they really, really need.
Absolutely.
And I've been working with lots of strokes,
Right.
lots of Parkinson's patients,
Oh yeah.
lots of inner ear dizziness,
Yep.
vestibular patients,
Vestibular. Mm-hmm.
and balance issues.
Balance, gait issues.
And now more of that nervous system.
Right.
While you're not sleeping, what's up with your cognition?
Yep.
What's going on with your hormones? All
Exactly.
those inner things that get kind of sideswiped when you go to the
Yeah.
doctors,
And I think that has to do with, I think a lot of what we do, people don't really understand that we do it.
Nope. That is
Because
true.
as a neurotherapist, we look at a patient from a holistic perspective.
Yes.
And so I think the orthopedic sports medicine side kind of made us into this little small realm of, as far as what people thought we did. It put us in like they put us in a box, so to speak. So a lot of people are so unaware that, oh, when you come to a PT eval, oh, you're asking me about medicine. Oh, wow, my other therapist never did it. Oh, you actually putting your hands on me. Oh, wow.
The big one, blood pressure.
There you go.
Blood pressure. I'm like, what?
Blood pressure? That's insane. If I had my primary care physician's office, oh, you are actually, you need my medications? Wow.
Yes.
Nobody else has ever, so it's that's one of the things I love about neuro, is because it embodies wellness.
Yes.
And that's why our podcast is so important. Neuro wellness. It's not just looking at things from one perspective, but it looks at everything, because everything comes down to the brain and the nervous system, honestly. Because if your brain is not functioning properly, the rest is history. Nothing else is going to work.
That's true. The brain is often forgotten.
The brain is very much often now, I have to admit, though, in today's time, I'm hearing more and more about how people are finally getting to where we were years ago, where they're looking at things from a brain perspective more, because they realize the importance of it.
Absolutely.
And so, what we do is so needed, but it's also so misunderstood, because they don't understand that when they come to physical therapy, this is what, is going to transpire. You're going to actually delve into me as a whole person, And I often tell my patients in fun, I'm like, the head bone's connected to the neck bone, that kind of thing. So you can't have one and not have the other. And all of that, everything is interconnected and interrelated in the long run. And in order for you to have true wellness, in order for you to function like you should, in order for you to be able to get up in the morning, get ready for your day, whatever that entails, your body has to present itself in a well state.
Absolutely. And I feel like the confusion comes from the the societal norms.
Yes.
You know, you go to a doctor, you tell them your symptoms, they give you a medication.
Correct.
And that's what people are used to. They're not
That's
used to
it.
getting a full exam. They're
Right.
not used to talking about sleep. They're not used to talking about their stress.
Nutrition.
Yeah, nutrition is a big one.
Yeah. They're not used to somebody asking about, how do you eat or how do you drink, as far as
Mhm,
your water intake, how much water are you taking in? Yeah, you're
mhm,
right. And that's the term, societal norms,
mhm.
because the norm has been that a physical therapist does not look at all of this. I used to be, sometimes some of my patients were like, "Are you a physical terrorist?" I'm like, "No."
Oh, yeah.
PT, you're my PT. My other PT was a physical terrorist. No,
Mhm,
I am the person that's gonna help you be the best you, especially when it comes to neurological disorders.
mhm.
That's
Absolutely.
the other thing, because I think from a clinical standpoint, we are as successful as we are with our patients because we look at them holistically
As a whole,
as a
yes.
whole. Yeah. And we think outside the box. Treatment is not cookie cutter,
Nope.
you know,
Love
and
that.
and it can't be because everybody's different.
Mhm. It's really,
So,
really
so
awesome.
can you think of any patient that comes to mind in your years who benefited from your neuro well perspective?
Oh my goodness, yes. I mean, I'm honestly working with this patient right now. It's been over a year. This person had a stroke
Wow.
and he literally went to an acute rehab. So an acute rehab is basically a place where you get intense therapy for like 3 hours.
Right.
On what you need to get an hour of PT,
Yeah.
an hour occupational therapy, an hour of speech, or you may get an hour and a half of a PT and an OT.
Right.
But unfortunately, he got kicked out because of insurance.
Oh yeah.
And he was literally bedbound, couldn't
Wow.
walk. They literally would rather order him a bed and equipment to go home than to actually work on his mobility.
Correct.
And this person was literally independent, doing everything, driving, working.
Right. Right.
So his life literally shifted.
Yeah,
And
absolutely.
I don't know how he found me. I guess he talked to one of his friends from Florida and they
Right.
looked me up and saw me that I was here in Massachusetts. And he called me up and said, listen, I need to get back on my feet. They kicked me out of rehab. They actually did home therapy as well.
Oh
Let me not
wow.
forget that.
Right.
Had physical therapy and occupational coming to the house. And of course, you're only able to do so much through insurance.
Correct.
So they only gave him a few visits for like 3 or 4 weeks and he was still in that same boat.
Right.
So when I came to see him, it was nice to be able to do a thorough evaluation and just really get to understand who he was prior to the stroke and
Right.
what he wanted to get back to, and going in depth about how are you sleeping, how's your
Mhm.
nutrition. He was a big hockey player,
Mm.
wanting to get back to those things. So I'm like, okay, let's take your goals and now let's work on those things.
Right.
Let's work on retraining your brain. Let's
Right.
let your
Exactly.
brain know that this is possible.
Exactly.
So I've worked with him since October 8th of last year.
Wow.
So he was literally incapacitated.
Mhm.
Now he's walking with his cane independently.
Wow.
He's just got his license maybe a month and a half ago. So now
Oh
he's
my
driving.
goodness.
He's eating better.
There
He's
you go.
coming down with his weight.
That's it.
He's back to what he is what wanted to do,
Correct. Yeah.
and it had to be from a holistic component
Component.
and really focusing on what he needed as far as nutrition and also having that mindset of, okay, I'm going to do this and I got to work on this.
Right.
Having that positive mindset is super important for your recovery.
Exactly.
So retraining that brain and just getting them back into that walking,
Mhm.
man, he's he doesn't want to let me go. I'm like, listen, we did floor transfers last week. I'm like, listen, you're not gonna need me much longer.
After a while, yeah,
After a
yeah.
while, you pretty much done met all the goals that we
Well,
need.
you've done your job when they don't want to leave you. When they're like, are you letting me go? No, please.
I told him, like, listen, maybe a few more weeks. But I
Right.
know he has an AFO or an orthotic on his ankle
Okay.
because he did have a foot drop, but he does have really good ankle mobility now.
Yeah.
Because I make him train without the orthotic a lot. And I
Right.
get him on that lovely blue pad that focuses on that ankle strategy.
Oh, yes.
And he actually loves it. Most clients hate that blue pad.
Oh, yeah. Yeah.
But he's done so much work on himself, and
That's amazing.
he's doing awesome.
And
So
that's
neuro PT is where it's at.
it's where it's at. I'm telling you. I tell people all the time. I tell my students when they come, they come with, preconceived notions of things that they think they may want to do when they, graduate, and those that didn't really think about neuro, by the time they leave the clinic, they're considering neuro strongly, because we're pretty good at convincing them in my clinic. And I think I'm pretty much about four for four right about now.
Oh, I love that.
As far as my PTs are concerned.
Yes.
And so it allows you, and this is the thing, like I had a conversation with another physical therapist recently who told me there was like almost a fear of doing outpatient, and because for one, they hadn't done it in a few years. Two, I think sometimes they feel like neuro is too tough, but
They do.
yeah. And I find that once I kind of tell them, listen, you have a freedom to be as creative as you want to be, that you don't typically have a lot of times with a lot of the other diagnoses. And we all know about burnout, and then the basis of burnout a lot of times is because you feel like you're in this rut of doing a lot of the same things over and over again. And there's no challenge, there's no mental stimulation. There's nothing to look forward to, when you go in to work. So it's a drag almost to go to work.
It is.
But when you're dealing with neurophysical therapy, because I can't really attest to neuro for any other professions, but when I go to work, it's an excitement to see, okay, how much better can I get them this day? Like yesterday, we saw great results with that person dorsiflexing without their ankle foot orthotic or AFO. Man, let's see if we can continue along those lines. And now we're going to, put it into the functional movement of walking and see how well they do. And so you challenge them, you challenge that brain, you get that neuroplasticity, occurring through the repetitions of their task and their movement. And then you throw in, this exciting activity. Like I had a patient who was interested in working on his balance. And he used to play baseball when he was younger. So I was like, okay, perfect. One of the things that I noticed with his gait was that he was not loading into the right leg well. So I was like, okay, we can do this fun way of engaging his right leg and implementing baseball at the same time. So we had, those little Velcro gloves that you can use with the little Velcro ball. So we have that in the clinic. So what I did was I had him test out, some throws before with just static standing. We worked on static standing, made it into a dynamic activity with the ball throws, him throwing the ball to me. Then we worked on it even further, having him step and throw. So he's stepping into that right leg and throwing that ball, dynamically. So he did so well. But what made it even better from a neuroplasticity standpoint was the saliency of the activity.
Yes.
Then he went back into those years, and like, oh man, this is like you know, days of old. Yeah, it's like I'm playing baseball again. And
Yes.
those throws got better, and that balance got better, and that weight shifting got better. And when
Love
he
it.
walked out of there, he was walking so well, he didn't even realize it, because I
I
have this
love that.
tricky way of watching my patients when they don't see me. So especially when they're walking out of the clinic. And so, I was like, yeah, this is what neurophysical therapy is all about for me.
Yes.
That was such a great session that we had. And he talked about that up until I discharged him.
I believe it.
So,
And
that's what I love about what we do. I love the educational part of what we do because,
yes.
I spend a tremendous amount of time educating my patients because I tell them, I said, you only spend so much time with me. You're home a significantly more larger period of time, without me. So I'm going to give you the tools.
That's it.
It's up to you to take those tools and use it. I often use the analogy of us running a relay, track and field fan here.
Good one.
Yeah. So I was like, okay, I'm going to run the first leg of the relay. You got that next leg. So when I pass the baton on to you, it's up to you to take that baton and run to your fullest, that distance that you have to run. So usually when I do that with them, they're like, okay, now they understand the importance of that HEP. They understand the importance of
exercise plan.
Those exercise plans and them doing their part because there's only so much that they can do with me. And so that's the other side of the wellness, I think, the educational side and then the transitional side, so that they are not so dependent upon me as the clinician. They learn to kind of put it on themselves.
Absolutely. And it's our job to push them.
It's our job to push them. Absolutely.
I always say, I'm not going to be standing next to you when you're going to a restaurant. So you got to figure this out. The
There
road
you go.
is not flat.
There you go. And they love it. They love us for it. They love, we're sometimes we're brutally honest with them, but it's the honesty that they love and they appreciate, and they love to be pushed, and I think that's what is sometimes tricky with especially with newer therapists. They're hesitant to kind of challenge their patients, but challenging your patient is what helps them to get better. That's a significant part of what we do as neurotherapists and as physical therapists in general. They're not coming to us to just sit there and do random 3 sets of 10 and
oh my gosh, so boring. That's what most people think PT is.
That's what they do. Exactly.
You go there for a car accident because you had a car accident,
right?
You do exercise in the corner, and the person walks away from you. Like, that's what people tell. They say that all the time. I'm like,
all the time. I was floored when I had a patient who was coming to me with migraines shortly after I first opened the clinic. And when I put my hands on her during the eval to palpate her upper traps and her neck muscles to see, if she had trigger points and if she did, where were they and how the tone of the muscle was, that kind of thing. She was like, oh my gosh. She was like, I've had therapy at least 2 other clinics. And she was like, you're the first therapist to put your hands on me. I was like, what? She made me, I stopped in my tracks. So I was like, huh? She was like, she's like, I tell you no lie. She said, I've never had a therapist. I said, well, first of all, the physical therapist. Come on, people, put your hands on your patients.
Absolutely.
If you're not putting your hands on your patients, you're doing a disservice. I had a need today that I saw, and I literally did some manual massage, soft tissue work on his hamstrings and his gastrocs. And
Okay.
then I pulled out the massage gun and worked his hamstrings with that gun. And I tell you no
Wow.
lie, we got an extra 7 degrees of knee
What?
flexion because of that.
That's awesome.
And he was having so much trouble breaking 95 degrees. But after I worked on that muscle, and I wouldn't have known that if I didn't put my hands on him, then
Wow.
it facilitated him getting more range of motion. So
Sheesh.
we have to
Amazing.
change the way we are looked at, and
Mm-hmm.
it's going to take us
Us
older
having these
therapists
conversations.
having conversations, but also us older therapists teaching the younger therapists,
Mm-hmm.
and influencing them. And the beauty of media is we can get the word out in so many different ways. And
Yeah,
that's why we're doing this podcast, you know,
absolutely.
educating and letting them know. But more importantly, we're trying to bridge the gap between neuro education and neuro wellness that I think exists out there. And a lot of people don't understand that it's not just the neurologist that knows some of this stuff. You got some pretty good
Yes.
physical therapists, doctors of physical therapy,
Mhm.
of neurological physical therapy
Yes.
that that know
Know
how to
our
help
stuff.
them, that know their stuff. That's right.
It's so
That's
alarming. I want to add this too, that sometimes you'll go to my patients will go to a neurologist and they either won't even refer to physical therapy, or they just say, you can go to PT, but they don't have a clue to even send a referral to a neuro PT. They
right.
just write the script and say, hey, you just go wherever, or you go to the hospital, the basic hospital outpatient.
Correct.
And that's a big disservice to a lot of people.
It is. It is.
And it's not good.
And
Go
it
ahead.
takes educating the doctors as well.
Absolutely.
Because a lot of them don't understand, one, that there's a difference in our knowledge. We've got
Mhm.
very good sports physical therapists who are certified. We've got very good orthopedic physical therapists who are certified. We've got excellent wound care
Oh, yeah.
physical therapists. We've got um,
Women's health,
women's health, pelvic
health. Mhm.
pelvic health. So a lot of doctors aren't knowledgeable about the variation in skill set that we have.
Mhm.
And so I think it takes us educating. That's one of the reasons why prior to me opening my clinic, I went and introduced myself to every single neurologist that was in my area.
I love that.
Because first and foremost, it was about establishing a connection and a relationship with them, because I wanted them to know who their patients was going to see.
Mhm.
So it afforded me the opportunity to meet them and them to meet me, and then just have a interconnectedness in their treatment plan, because ultimately it comes down to the betterment of the patient,
Absolutely.
and egos aside.
Mhm.
um, and then to educate them on just what we just talked about, the fact that there is somebody out there that knows neurological physical therapy and knows how to help these patients. It's an orthopedic patient, or I'm sorry, an orthopedic physical therapist is not
Mhm.
going to want to know what to do with a stroke patient,
Correct.
and so they tend to stay in their lane. So
Mhm.
um and if they try to see them, it's probably not going to be as good of a treatment as if that person was seeing a neurological physical therapist. So It's
beauty.
education to these doctors is so, if we can kind of
Important.
break some of the egos, because some of them are so egotistical.
Mhm.
I'm gonna be honest with you. Some of them are
Mhm.
like, I'm the doctor, I've got all this medical
Background and
background and knowledge, and who are you to tell me anything kind of thing. But
right.
some of them are very good, especially the younger ones. They're more receptive
Yes.
to learning about who we are and what we do. So I have to say that I've had very good luck with working with the doctors in my area.
Mm-hmm.
And it's been a privilege to get to know them and work with the majority of them. Can't say all of them were,
Mm-hmm.
willing and receptive like the majority. There were a couple of them who, they were hard nuts to crack, but
I believe it.
I don't give up easily. So
No. Mm-mm.
I
Mm-mm.
am my mother's child. And she's a determined woman when she gets ready.
Oh my goodness. Wow. This was a great conversation.
It was a great conversation, and I hope everyone got something out of it. I am excited about what we're doing and what we're going to be presenting through our podcast.
Yes,
And I look forward to us being able to do more of this.
absolutely. 100% agree. And I want to thank you for listening to the Neuro Wellness Conversations, where clinical insight meets lived experience. If today's conversation resonated with you, share this episode with someone who could benefit. Be sure to subscribe so you don't miss future conversations on neurologic wellness and nervous system health. Until next time, keep supporting the nervous system that supports you.
Thank you, guys.
Thank you.
Let's have a conversation about cognitive decline. Let's have a conversation about physical decline.